Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Maintain a 2 meters distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2 meters distance from others. I will now report our current case counts. There are 143,649 confirmed cases of COVID-19 in Canada and 46,849 cases in Ontario. Chatham-Kent has 366 cases and Sarnia-Lambton has reported 344 cases. Michigan now has 115,870 cases, with 14,170 cases being in Detroit. Today we are reporting a total of 2,631 cases of COVID-19 since March, an increase of 7 cases from yesterday. 1 is a local healthcare worker, 1 is a resident of a retirement home, 1 is a case in a school, 2 are close contacts of confirmed cases, 1 is community acquired, and 1 is still being investigated by our staff. 2,454 people are now resolved, and 101 cases are active and being followed by our health unit. 3 people are in hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are 3 retirement homes currently experiencing a COVID-19 outbreak. With return to school, parents are reminded to conduct daily symptom checks before sending their child to school. The Ministry has released their new assessment tool, which can be accessed through our website or ontario.ca. Symptoms can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Windsor-Essex has 3 assessment and testing centers, including St. Clair College Sportsplex, Windsor Regional Hospital Olette Campus, Erie Shores Healthcare in Leamington, and SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to quick access online, you may receive your results before the health unit contacts you. Please continue to visit our website at wichu.org for the most current information on schools and workplaces. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. Over the weekend, we reported 9 new cases, and today we are reporting 7 new cases. Over the weekend, the province reported 772 cases, and in the last 7 days, reported on an average of 335 cases every day. In Windsor-Essex, during the same period of time, we reported on an average 5 cases per day. While this is a good news for our region, but we cannot be complacent. The number of cases what we see today is the reflection of what we did almost 2 weeks ago. Many of you remember, 2 weeks ago we talked about the community clusters and the spread that involved many social gatherings in our region. Similar trend was observed across the region with many cases, similar trends were observed across the province with many cases attributed to these private parties and social gatherings that resulted in spread of COVID-19 in the province of Ontario. In a response to this, on Saturday, Premier Doug Ford announced that due to the alarming growth in the number of COVID-19 cases, the government is taking immediate action to reduce social gathering sizes in every region of Ontario. For the next 28 days, indoor gatherings will be limited to 10 people and outdoor gatherings to 25 people effective immediately. This new legislation has been introduced to levy a minimum fine of $10,000 for the organizers of illegal parties and a $750 fine for guests. The new rules do not apply to events being held in staffed facilities such as movie theaters, restaurants, banquet facilities, gyms, places of worship, or convention centers. These restrictions are meant to restrict the private gatherings and empower our local police to take immediate action to shut down these parties. The exclusion of staffed facilities from these gatherings limits was intentional to avoid any negative impact on the local economy. It is now more than ever important for the local businesses and economy to ensure that they are following the guidelines and recommendation to ensure the safety and well-being of everyone in their business establishment to keep their businesses going and keep the economy of the region going. There are a number of guidelines available on our website, and I would like to remind the local residents and business owners, operators, to review all these guidelines to prevent the spread of COVID-19 in our region. The COVID-19 pandemic has highlighted the importance of strong public health system for Ontarians. The role of public health professionals has been critical into reducing the burden of disease in communities across the region. This week is Environmental Public Health Week, and I would like to take this opportunity to recognize the role that our environmental health team has played during this pandemic. They have worked tirelessly behind the scenes to support the community throughout this pandemic, including rollout plans for reopening of the economy, specifically in businesses, schools, and other institutions. Education and training to members of the community regarding infection prevention and control. Investigating and responding to certain types of complaints, including complaints regarding self-isolation, complaints regarding social distancing, complaints regarding business control measures and practices, providing ongoing support to shared living facilities, assisting with supply and swab transports, enforcing and educating individuals and businesses on provincial orders to keep our community safe, providing support and guidance to various business sectors, including implementation of control measures as they plan to resume or continue operations safely, responding to questions related to infection prevention control, PPE, and other controls routinely to the residents as well as to many businesses. With so much work to do specifically for COVID-19 response by our Environmental Health Division, the team is also fulfilling their day-to-day work, including animal bite investigation, outbreak investigation, seasonal housing inspections, other on-demand inspections such as opening food premises, complaint inspections, investigations, food recalls, adverse drinking water response, public education on vector-borne diseases, mosquito surveillance, West Nile virus disease, etc. I would like to thank all environmental public health professionals and public health inspectors in our community for their hard work and dedication through this unprecedented times. Your great work and dedication has not gone unnoticed. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with AM 800.
No problem. Just to your point about the updates to the gatherings, just say an individual has an event planned or had an event planned for their backyard, knowing they could allow up to 100 people, just say a wedding, for example. What would happen if this person had this wedding planned, let's say, and went with the party in their backyard? Now with these changes, would they still get, I guess, a warning or charged if they had this already planned?
Well, I think if they have planned, then obviously that means that the party didn't happen. They have to change their plan because this is what the restrictions are. And if they may want to consider switching to a banquet hall or some other facilities where they can officially or legally hold that level of gathering depending on the size of the facility. So they have to make their change to their plan. And it's unfortunate, but this is what the direction is for the moment.
I know we all want the spread to stop, but how is that fair for the public? For example, let's say they've been planning this for a while, knowing they had 100 people, and let's just say the wedding could be this coming weekend. In a week, they would have to drop their current plans to go to the limit of 25?
Yeah, as I said, it's unprecedented time. There are a lot of changes that are happening across the region. There are many restrictions currently being rolled out. At one point, it was not even possible. So I think it's we have to take it with a grain of salt. That this is one of the things that has happened across the region. We have seen a number of cases as a result of that, and it's unfortunate, but it is the direction, and all these directions are meant to provide more safety and more better measures to prevent the spread of COVID-19.
Just a quick one here. If the numbers keep on going up in the province, could you see the restrictions put in place again for restaurants, bars, movie theaters? Is that what you're hearing at all from the ministry?
Yes, that's also possible, and we have heard our premier saying that as well, that everything is on the table. What is critical is how these spreads are happening and what the epidemiology is suggesting. So just based on these numbers, what we have seen, most of these numbers and increases are seen as a result of these private gatherings and social gatherings. That's why the restriction is there. If there is any evidence to suggest that the spread is happening through, let's say, bars and restaurants or some other businesses that or places of worship or any other places, then the restriction may be in place for those areas. So I think it really depends on the epidemiology, but that's why it is important in my message to the businesses and to our local areas is now is the time. Please put your effort in the prevention piece, because once it starts, it's very difficult to contain, and this is what we have seen. Our numbers at one point were close to 80, less than 100 in the province, but now we are up to 400 or close to 400 cases a day. So it is time that we have right now in our region, our case counts have been relatively stable. And as I reported in the last week, on an average, we reported 5 cases a day, which is a good sign for a region of our size. We like to keep it that way, and we can only do it if all of us do our part and invest more in the prevention piece, because that's the only way we can avoid any of these restrictions in our region. And this is what we like to see. This is how we want to see our region moving. We want to protect our economy. We want to protect our social well-being. We want to protect our health and protect our vulnerable in the community. So we all have to do our part and make sure that we keep it that way, so that none of these new restrictions, which limits all of these activities in our region, can be implemented or should be implemented here. As long as the numbers are stable, as long as we are doing good, I think that would be a good sign for our region to stay in this stage where we are right now.
Thank you.
Any questions from Blackburn?
Hi, I know you're not the one who, sets these rules, makes these rules, but back when it was opposite, Windsor had a high number of cases and the rest of the province had low number of cases. The rest of the province was able to move forward and Windsor was held back. Was there any consideration of not making Windsor, where we have a low number of cases, or other parts of the province that have low number of cases, to not implement these additional rules? I mean, I know they did just for Toronto or later last week, but was there some discussion to that? Do you think this is necessary here right now with the low number of cases we have?
Yeah, I think as you rightly mentioned, that there are all these consideration that goes into play, and as the premier has mentioned, that his intention is to take the regional approach more this time, as he continue to see cases popping up in specific region, and to target that, and maybe some of the measures that are or maybe some of the way that these cases are spreading. So the focus would be on those specific regions and those specific sectors to bring those guidance. And similarly, what we are seeing is not only in Windsor-Essex, so we have seen some of the impacts of these parties, social gatherings, as in the form of community clusters. The good thing was it didn't resulted in the large number that some of the other regions have seen. So I think it's helpful for us to be more proactive and take some of those measures. The options are there, and that's why I said that many of these businesses, many of these restaurants, convention center, banquet halls, all these places are there to support and ensure that the public can still go on with what they do. The private gatherings, these private parties, it's very difficult to enforce. It's very difficult to see what's going on, and with what has happened across the region, we don't want to see it in our region as well. Our region has suffered a lot. Our region has seen probably the worst in the province, given the rates. We still are one of the highest rates of COVID-19 cases in the province, given our population size. So I think as much as it's good to see the numbers stable, we shouldn't ignore the fact that it can get worse. So I think we need to be more proactive rather than trying to be more reactive.
Yep, thank you.
Any questions from CTV?
Yes, good morning, Doctor. I guess bottom line here, I was out in the community this weekend, and bottom line is people around here feel cheated right now because, as Maureen alluded to, we've been doing well recently, whereas the rest of the province is kind of lagging now. And, you know, when we were held back, they had no problem moving to stage 3. Now it's the opposite, and flat out, residents feel cheated. Now, does the epidemiology results warrant this type of blanket for everybody, do you think?
Well, Bob, as I mentioned earlier, right now we have seen some evidence of these private gatherings and parties that are happening across the region. So we have seen some evidence, and lucky for us, we haven't seen a significant or a major outbreak as a result of that. We still are cluster. If you recall our first cluster, we have seen 37 cases. In the second cluster, we have seen more than 20 cases. So some of these things are pointing to the fact that there are those activities that are happening, and I think lucky for us, it didn't result in a major outbreak, but it did result in a number of cases. So I think the epidemiology, as much as it can tell us, it is telling us that yes, there are these things that have the potential to be worse. And as I was telling this to Rob, that it's unfortunate that people have those plans in place. And I get that, and I can personally even relate to a family gathering that I was supposed to participate in the next couple of weeks. That has to cancel. That has to be changed. So I think these are all the realities of this world that we are living in, and it's unfortunate that the people who are at the receiving end, they feel it that way, and I can get that. I totally understand that part. But these are unprecedented time, and we just have to acknowledge that we have to be creative. We have to be very careful in what we are doing to ensure that we are keeping our community safe.
Okay, fair enough. $750 for guests, $10,000 for organizers. You said that police will have the authority now to clamp down on this. Do you anticipate that happening right away, or will they take the approach that you had taken earlier in the pandemic, where it's education first, and then if you're kind of a repeat offender, then we'll smack you?
Well, there are things. Some of these things are very clear cut, right? So what educational approach we have taken is in the situation where you can arguably say that, let's say if someone is not wearing the mask properly and saying, yeah, well, you need to make sure that the mask is covering your mouth and nose, and you have to wear the mask all time, including the spaces where you are not, or similar situation. But if there's any clear violations, so for example, these parties, you can say that if a party of 25 is allowed, if you're seeing 50 people, I think that's a clear violation. So I think I'm sure that our police enforcement agencies are also people. They understand, they recognize that if there's any clear violation, then they will act. And the whole purpose is empowering police, and making as part of the legislation is to ensure that speedy action is taking place, and it is preventing people from engaging in activities or behavior that have a large potential to impact the entire community. So my guess is, and based on the legislation, that the action will happen immediately, unless there is some gray area where people can say arguably that maybe they needed education, so they will be provided education. But some of these things are very clear cut. The gathering limit cannot be combined. Indoor, outdoor cannot be 35. It still is. Indoor is 10, outdoor is 25. So if you're even having an event, either it has to be an indoor event or an outdoor event. You cannot have an indoor-outdoor event and still go to 35 people limit.
Okay, great. Thanks for that.
Any questions from the Windsor Star?
Yes, good morning. This may be for Teresa. I'm just wondering, with a few more cases among school-aged children, is the handling of those cases still going smoothly as it did with Stella Maris with the public health nurses?
So our planning is continues, and we are adhering to the guidance documents we created along with the school boards and following those. And I think for the most part, everything is continues to work very well. Our nurses are very closely linked with the school principal and the school boards. So I think everything seems to be going as planned for now.
And I'm just curious, is it too early to say whether or not any transmission may have occurred inside those schools yet?
We have had isolated cases, and there has not been any evidence of transmission at this time.
Thank you.
Any questions from Windsor?
No, thanks. My questions were answered.
Any questions from CBC?
Same, you guys got them all, thanks.
Okay, any further questions from AM 800?
Yes, not sure if this is for Teresa or Dr. Ahmed. In regards to the second cluster, Dr. Ahmed, we received a tip at the radio station that one of the individuals that went to Collingwood knew they had COVID. Has the health unit looked into that? And if so, has any charges been laid against this individual?
Rob, I cannot speak specifically to any individual or any individual cases, but I can assure you that when we have information that if someone violated anything, we do take action. And all I can tell you at this time, for that cluster, we didn't issue any violation.
Okay, thank you. And I'm not sure if this is for Teresa or Mike, but I'm looking at the potential public exposures page right now, and Crunch Fitness is still on it. The date of exposure was September 8th, and they're still on the list, but businesses that were on the list last week are no longer on the list. Is there a reason why?
So the establishments on the list will be removed after 14 days of the exposure. So if you're saying that one facility is on September 8th, so then on the 22nd, they should be removed, or they will be removed.
Okay, so just because, yeah, there was a couple businesses last week, so their exposure date was earlier in the month, so that's why they're removed right now.
Exactly.
Okay, just want to double check there. Thank you.
Any further questions from CTV?
No, I'm good. Thank you.
Blackburn?
No, thanks.
Windsor Star?
No, thank you.
Windsor 8?
No, thank you.
CBC?
No, thank you.
Okay, have a good day, everyone.
Thank you.